Welcome to Dispatching Occupational Therapists, responding to the mental health needs of first responders, an Ontario Society of Occupational Therapists podcast. We invite you to hear from experienced occupational therapists and be inspired to work in this rewarding area of practice. This podcast is for informational purposes only. While some of the information may be generalized to other clients or situations, it is not intended to be used as clinical advice at any time. Any health professional listening to this podcast is required to use their clinical judgment, make their own decisions for best care for their clients. Furthermore, the information provided and/or opinions expressed by the members of this podcast are strictly applicable to the specific client and situation to which they are referring. The members of this podcast and OSOT waive all liabilities relating to listeners' use or distribution of this information for any purpose other than what it is intended for. This podcast discusses a select number of assessments and treatments, but by no means does it represent all of the clinical options that may be utilized with this population. For a comprehensive list, please refer to OSOT's reference guide, Occupational Therapy in Mental Health and Return to Work. First, we'll just take a moment to introduce each of us to you. And to start off with, my name's Nancy Gowan, and I'm an occupational therapist working at Gowan Consulting. So we're a national occupational therapy company. And I've been doing work with several different groups of employers and employees for over 30 years, specializing in stay at work and return to work. And the thing that I love about working with first responders is just being able to see the resilience that is there, the ability to help people to work through very traumatic and difficult situations, and to know the value of their work. So I'm going to now just introduce you to an amazing group of occupational therapists that have come together to share with you some of their strategies and ideas. I'm going to start with Brenda. So Brenda, if you can introduce yourself.
Thanks, Nancy. My name is Brenda Power Ahmad, and I am also an occupational therapist with a company called Entwistle Power Occupational Therapy, which is a part of the FunctionAbility family. And we are a multidisciplinary, community-based rehab company located throughout all of Ontario and also into British Columbia. And this is my 23rd year now, I believe, of practice as an OT in the community. And part of that treatment that I have provided and developed a bit of a passion for over the years is that psychosocial focus to rehabilitation that we see so often within this group. So thank you for having me.
Wonderful. Thank you, Brenda. Sandra.
Hello, everybody. My name is Sandra Moll, and I'm an occupational therapist and associate professor in the School of Rehab Science at McMaster University. And my primary program of research is around workplace mental health. And over the past 3 years, I guess, I've been involved in a really interesting national project with first responders, looking at how do we build a tech platform, I guess, to support workplace mental health for the first responder community. So that involved engaging with police, fire, corrections, paramedics to build an app that's actually just launching. Right now, we're doing beta testing around the app. So happy to talk a little bit about my work in talking with the first responder community about their experiences.
Thank you, Sandra. Heidi, tell us a bit about yourself.
Hi, everyone. I'm Heidi McLarty. I'm an occupational therapist in Sault Ste. Marie, Ontario. And my business is Potential and Possibilities Holistic Occupational Therapy. And I've been practicing OT for 17 years in a variety of different practice settings. And I'm really passionate about working with first responders. It's been a few years since I've started working mainly with paramedics and police. And yeah, I'm really passionate about getting to the root of what's going on with their nervous system and helping to establish safety and re-engaging in meaningful occupations in their lives. So I'm really happy to be part of this discussion.
Thanks, Heidi. Thanks for joining us. Cheryl.
I'm an occupational therapist. I'm out of the Hamilton area. I've had many different work practice opportunities, but I did spend a good 10 years starting to get interested in mental health and return to work through auto insurance work. And eventually that moved me into disability management coordination. And through that, I've continued to maintain an interest in this particular area. Albeit currently I'm working in the home health environment, I am experienced with our individuals who are on the front line and working under pandemic conditions. And this has once again sparked my interest in, how to support first responders and people on the front line.
Great, thanks, Cheryl. Looking forward to some of that input. Thank you. Moira.
Hello, everyone, and thanks, Nancy, for including me in this committee and this task force. I have been an occupational therapist for, I was counting on my fingers, 35 years this spring. So been around the block a few times. 25 of those years have been working in the auto insurance sector, with most of my clients having had experience of some kind of mental health impact from their motor vehicle collision, and very many of them having post-traumatic stress disorder. So just seeing the impact that trauma has when it's just been one occasion, and now having the opportunity to develop a program within Gowan Consulting for our first responder clients that we get that have had multiple exposures and chronic exposures. I'm just really, really interested in this whole area and learning as I go. And it's just a great, I'm so privileged to have this opportunity and work with some really interesting people who are struggling and watching them get back to full productivity as best they can.
Great, thanks, Moira. Vikki, welcome. Tell us about yourself.
Hi, everyone. And first off, let me just say thank you for the invitation to participate. Honored to be in such great and amazing company. So thank you. My name is Vikki Madden. I'm an OT and practicing psychotherapist. I have 15 years of experience working in the field of mental health, and I'm currently working at FunctionAbility, working with clients in KW, Guelph, Hamilton, Halton, working directly with folks who have mental health challenges, who are struggling with PTSD, depression, and anxiety as it relates to workplace accidents or traumas that have occurred at work.
Wonderful. Thank you, Vikki, for that. Looking forward to lots of insights from you and your team. Jocelyn.
So I'm Jocelyn Cowls, and thank you so much for including me in this discussion as well. I really enjoy all of our discussions that we have with these amazing therapists. So it's a wonderful group to be a part of. I have been an OT now for almost 30 years and exclusively in mental health the entire time. And about 20 years ago, began to work with first responders of all groups when I was working at Homewood Health Center. And I really just sort of fell in love with this group of clients in that I really respect the work that they do, putting their lives often on the line every time they go to work, and yet how much, I guess, had compassion for how much they struggled and often suffered in silence when they would experience traumas and experience PTSD, and how hard it was for them to ask for help, and yet how motivated they were to get that help and to get better again and get back to work. So most of my focus with them has been about becoming well and getting back to work. And I've since left Homewood just to go and do this on my own. So I primarily work with all first responders through WSIB or through Veteran Affairs. With my company's called Resilience at Work, but it's really just me at this point. Thanks very much for including me.
Thank you so much. I know that throughout these podcasts and this series of podcasts, we will be introduced to a number of other occupational therapists, but I'm just blessed and privileged to have you all here today. And I thought maybe the first question we want to ask is, what is a first responder? So how do we define a first responder? Maybe what are the groups that might be included within the first responder populations that you have worked with? I'm going to throw it to Sandra maybe, because Sandra, you have done a lot of the research in the last few years there. So
The definition is evolving, I have to say. The actual term that I use in my work is public safety personnel. So that's a term that's being used nationally to think about people whose job it is around public safety. So that can include police, RCMP, firefighters, volunteer and paid firefighters, paramedics, corrections officers, border officials, search and rescue personnel. So that's kind of, we talk about public safety personnel. And I know sometimes when we talk first responders, that definition is also evolving in Ontario. It can also include healthcare workers as well. So I think that the definition is changing over time. So sometimes you'll hear the term public safety personnel, and that's the term that is kind of being put forward at a national level, but you'll hear both.
So tell me a bit about the culture of first responders and how that's different than if I'm doing post-traumatic trauma work with someone else. Is there a different culture? Is there a different experience that we need to understand as occupational therapists when we're working with the PSP or first responders groups?
I think between the first responders, there's definitely a different culture within each of them. And it's really, I think they, as clients, they appreciate it when they feel you get it, that you have obviously we're never going to get it. And I say that to them right off the bat. I don't know what you've experienced. I've never walked in your shoes. And I've worked with people who are firefighters or police officers, so I understand some of it, but I've not experienced it. And I want to be very clear about that. But they do appreciate when I understand the kinds of things they see, or the kind of culture in terms of what their peers tend to be like, or what the management tends to be like, or what their experiences have been. So I feel like it's really important as an OT to take the time to research that or explore that or learn it in whatever way you can, so that you're coming with some of that understanding and knowing the differences. And I feel like it's really essential too when we're talking about returning to work, because we need to understand what we're returning them to. And what are those differences that we need to be considering? Is let's say a firefighter, if we're returning them to administrative work a Monday to Friday, they're not going to understand why are we doing that? It makes no sense for them. That's not how they work. They work 24-hour shifts, 7 days a month, and they don't know how to work in the office environment. They want to work with their crew. And so understanding that that's their culture, and just being with them as like kind of a family is what you want to return them to. Or understanding that the culture with police, that although it's improving, I think one thing that I often see as part of their experience is that when they do identify having a mental health issue and they leave work, they often feel abandoned and feel left. And that's extremely hard for them. And I think so those are some of the nuances that are a part of different first responder cultures that I think are important for us and inform how we will then work with that person.
Is there anything else that anybody else wants to share?
Yeah, sure, Nancy. I just wanted to add a little bit in terms of what Jocelyn was speaking of. And I think, recognizing that culture and trying to get as close to it as possible as OTs involved in return to work programs is very important. And I think that, as much as opportunity and consent and safety will allow, in my discussions with first responders, if you do have the opportunity to get out there and be in the fire hall, or to be on a call, or to listen to the dispatch, to experience that as much as you can, I think that my perception is that that is really appreciated by the client that you are working with, that you're making that concerted effort. Some of our OTs go out and they don the fire equipment and they walk with the the uniforms on, so that we can understand it's not about just being mobile within the workplace. It's about being mobile despite some challenges while donning and wearing, I don't even know how much they weigh, but the weight of the uniforms and the tools and everything that we're working with. So I think that as OTs, of course, that's not rocket science to us. We know it's important to be aware as best we can in terms of the day-to-day life and tasks that a client is involved in. But I think it goes an extra step in terms of working with this population, in terms of our efforts to try and become aware as best we can in terms of what they're experiencing during that return to work program.
And you bring up a great point, Brenda, that, you know, no matter what client we're working with, we have to understand the work that they do, the culture of their workplace, their work environment. I guess with PSP, with first responders, how do you do that? Because I'm not going to run into a fire with a firefighter without training. How do you do that? Or how have you as therapists gotten to know those specific cultures or those specific workplaces? What specific things have you done as an occupational therapist that would allow you to understand that culture?
To expand on your question a little bit, Nancy, personally, I have worked with therapists who have been in the fire hall, even during downtime, because that downtime within the fire hall is also very important to understanding the operation and the interactions and the relationships between the firefighters as well. So I have seen that. I have mentored therapists who have been on the ambulance with the first responders in order to get that experience. And of course, there's a lot of politics and red tape and consent and everything that is involved with that. But I think that it is doable to a certain extent with some of the populations that we're working with. I'd be interested in hearing from some of the others in terms of their experience as well.
You know, we're talking about podcasts. There's lots of podcasts, there's newsletters. I think you can start to understand the culture and community. You know, one of the things I've heard is not to be shocked. So this is a group who sees things that are not normal, things that are violent, things that are really stressful, and they're often a bit protective. They don't want to expose someone else to the trauma that they've experienced. So I think it's really important to understand and let them know it's okay, and that you are aware of maybe some things that they might be have faced that they may be reluctant to share. And I know, Jocelyn, you can definitely speak more to that, but.
For me, I think I've been just grateful that a lot of my understanding has come from being allowed to, you know, be part of exposures where I'm in the workplace. So going into the ambulances and understanding what they look like and how they're operating and all the equipment and whatnot, or doing some, I was really privileged to be able to do some of the scenario-based training that the OPP do in their block training, where they are going from anything from having a police officer stop somebody at a traffic stop to a shoot or no shoot kind of scenario, and what it's quite scary, and they're using the rubber bullets. And I was able to be part of all of that as part of an exposure treatment sessions with clients. And so I was really able to understand that training that they have to go through, and that every year the annual recertification that they have to do. So that kind of stuff, it allowed me to understand some of the police culture in terms of what they experience, and also being in their environment and speaking with many police officers as I was in and out each day. So the exposures that I have done with people over the years have helped me be in the workplaces and help to get a glimpse of it and a bit more of an understanding of it. And then I think more intentionally, you know, just wanting to know more, you can do things like, I think just finding lots of really great books. So one that I've talked about before for police officers, again, it's one that the OPP gives to every new recruit, or they used to anyway, as recent as I think the last 5 or 10 years. It's called Emotional Survivor for Law Enforcement. It's by Gilmartin. It just really describes the culture well and what tends to happen to police officers over their time, and how it can lead to vulnerabilities for mental health issues. And another thing that I would think was helpful was taking a course with the International Critical Incident Stress Foundation. It's American, but because they're talking about critical incident stress, they're often discussing issues with many first responders. And one of the courses is about just understanding the culture. And the one I did was the police culture. And so as part of that course, I'm in it, and so are other healthcare providers, but then also there are police officers in it as well. And so you get that interaction with officers and just understanding it. So those kinds of things you can choose to do it very intentionally if you're not currently involved with clients and you're wanting to kind of build that knowledge. And then apparently, you know, a lot of places will, again, if it's safe to do so, you can ask for ride-alongs and things like that to, again, expose yourself to what that environment is like. So those are some examples of what I've done and what I would encourage other people to pursue.
the training of the first responders. So what are some of the training things that first responders need to do on a regular basis to be able to stay certified or to stay fit, or like the fitness testing, those kinds of things?
I can certainly talk to a few people, a few of the different populations. So certainly for, let's say, paramedics, I will often use the recertifications that they need as being part of work hardening, or things that they might have to do before they start their back in the forced return to work process. The CPR, or any, they can do some scenario-based training that they would have done when they were hired, but they can kind of do it as to build their skills again. It isn't something that they're tested in, but they can just, if they're feeling rusty, can revisit some of these scenarios online. For police officers, every year they must do an annual recertification, which involves a lot of different things. Some of it might just be shooting, like their target shooting. Some of it is CPR. There is also now in most police forces an aspect of mental health awareness. So the road to mental readiness, or some other ones that they may have brought in. And then of course, a component is also some scenario-based training where they are run through how would they handle a certain scenario, and they're kind of graded on it and judged in certain ways. And they have to pass all of those in order to keep their use of force, which is their taser, their gun, their belts, everything on their belt. And that has to happen every year. And so for a police officer who's been off work for a long time, that's often a really big step, because they often will describe themselves as being not really back yet, or they kind of feel like a new recruit or mall cop kind of thing, because they don't have their belt on yet. And it's very obvious to other police officers when somebody doesn't have their use of force belt. And so they feel often, I've had a lot of officers say to me, they feel very uncomfortable in that first stage of returning to work when they don't have their belt yet. And so being able to get this recertification is a really big deal. And yet it's really anxiety provoking as well. So what some places have allowed me to do is to help them gradually ease back into that scenario-based experience, so that they can then do it with a group of people as they would normally be required, and feel more at ease to do it and to pass, and then get their use of force back.
I know that generally in terms of firefighter, that there is regular training that is done with the firefighter population, and most of the municipalities who have firefighters have actual training areas within the municipality where you can go, and they will run you through the firefighting scenarios on a regular basis. I also have some of the college programs when we talk about paramedics and 911, a dispatcher, that there are opportunities where you can work with the college programs to use some of their training and their certifications for helping with some of that recertification as well.
Yeah, I've had clinicians access some of the training facilities specifically for the firefighters, using their confined spaces, in particular those training villages, I think that they call them, are really helpful to visit first, maybe just solo to do a bit of a tour, but then also to use those in the context of exposure therapy. I've also done tours of corrections facilities before a client steps back into work as a correction officer or a sergeant, just to get a feel for that facility. Each one is quite unique, and I think it was pretty eye-opening the very first time I did that, in terms of all of the auditory stimuli and some of the triggers involved in those locations that I would otherwise maybe have felt that they were benign, like all of the doors opening and closing. You really get to experience that firsthand when you're in the setting. So I think it's, you know, if it's possible to do a site tour or a site visit or a ride along, some of those insights are just so helpful when trying to support people and planning treatment.
So I did focus groups with corrections officers to try to understand their unique culture. And I would say they probably had the biggest impression on me. They said, you know, as a corrections worker, you know, for police, maybe you experience an incident, but then you may not go back there again. In corrections, they said, you know, nobody wants to be there. So the inmates don't want to be there. They're angry, they're under confinement. And as a corrections worker, you have to go in every day. So you see the same thing every day. Often there's a very strong rule-based culture. So very rigid rules that they have to follow. There's not a lot of sense of control over their work. There's a huge sense of surveillance. So they're always being watched as a corrections worker, and a high level of disciplinary action if something happens. So they have a very unique, challenging culture, I think, to work in.
And so that's one of the things I think in the culture of many of the first responders and PSP is that identification with that role. And then when they can't go back, how that really strongly impacts their mental health and being able to see themselves, because most of the people that we've worked with has been individuals who see themselves as part of that uniform, right? That is who they are. That is what they've chosen to do in their life. And then when they can't return to that work, that it's hard to see yourself in from a different perspective. And I know that we talk about that all the time with return to work and stay at work and having to make life choices about moving from a job. But a career, most of the first responders have chosen this as their career and identify so strongly with those roles that becomes very challenging. So as an occupational therapist, how do you help them to be able to reevaluate that? To be able to take a look at when it's a good decision to return to their job versus when do they need to maybe take a look at a different occupation. Heidi?
Yeah, so what I try to do early on in the process is really to try to reestablish meaning in their lives and, what lights them up, not even from the job perspective, but in their day-to-day lives, because I find a lot of the first responders, they don't always come to us necessarily at the start. It's been a while. They've been trying to, get better, trying to get back to things. And it's quite overwhelming, I find, for a lot of first responders because everything's about work. And when you ask about their day-to-day lives, they don't often have necessarily a schedule in place. They aren't doing the things that are meaningful for them. So just as a start, coming back to meaningful occupation and engagement through activities, I really try to reestablish that meaning and kind of more the flow of life as a start anyway, as I'm building rapport, as we're talking about the return to work, because I really find that if you can get them back to really finding more joy and meaning, then, thinking about and talking about other aspects that they enjoy and maybe, if, for example, you don't get back to your job as a first responder, what are some other things that you're interested in? What is your background? Not to say it's off the table, but let's just explore. So I feel like through that more exploring what really lights them up and using the meaning and the occupation and hopefully shifting over, to more joy in their lives and making it not so pressured about work, I try to have at least some of the conversation about, the day-to-day stuff. I find that really helpful.
I love where Heidi was going with that. And I think that that's one of the things that puts us at an advantage with working with this group or any group, really, in terms of identifying or knowing the importance of meaningful occupation. And then in working with our clients in order to help them identify that meaning and redefine their roles, maybe not as a firefighter or what have you, if that may or may not be realistic to return to, but just that return to meaningful occupation. And I think, who better than OTs really to help address that.
I also just want to point out that I think because occupation is so important for this group of people, that often is their main identity, Heidi, as you mentioned, I think absolutely is important to have them develop a greater balance and to have other occupations that are meaning for them to them as well. I really would like to caution new therapists, let's say, to not making a judgment about whether or not they can go back to their own occupation in the early days, because I think often, and I think I was I fell into this in my first year or two working with this group, that I thought, oh my gosh, they've had all these traumas in this place. They definitely can't go back to that job. That should be something they never do again. But however, with treatment and over time, I think you need to, reevaluate and get a sense after that, 6 months, a year, year and a bit, to say, where are you at now? And is this something with these new tools and with all the work that you've done, can you return to this job? Because it is so important to them. So not to make a judgment about that too quickly, to give them that time and ask them to just be patient, and can they give themselves some time to heal first, and then make a more informed decision about, is this something they can try with accommodations and with these tools, or do they need to go to something different? But it's not a decision to make lightly.
So I was wondering if some of the therapists could speak to this occupational analysis, because I think that's another thing that we do well as occupational therapists, is really to try to understand what are the aspects of their job and analyze those pieces of their job that may be more or less difficult. Because again, with mental health issues, they may be a bit surprising in terms of what are the things that people are really struggling with.
I think that you bring up a good point, Sandra, but that it is really important. I think that we have a picture, and this is what, for me as a therapist, sometimes gets in the way of me being able to help that individual, is I picture the job that they're doing based on the latest movie or the TV show or the Netflix show or whatever, and they'll never go back to that. Whereas understanding the culture is really about stepping back and saying, what is it that you do every day, and what are those pieces in terms of the job that you need to do? What are the decisions that you're making, the physical requirements, the cognitive requirements, and analyzing that job. And maybe that's not what you were talking about, Sandra, but I think that it's pretty easy for us to say, oh, a firefighter, I know what a firefighter does, but you don't until you really go in and look at that job and pull it apart and understand and listen to that individual about what they do every day and how that gets done. And what is the process? Otherwise, we think of always firefighters, saving the cat from the tree, or or going into the burning building, when a lot of the work that they're doing is a number of other things in terms of assisting around firefighting, around first response to the 911 calls, the other things that they're needing to do, the preparation, and even the downtime, and that roller coaster. I think, Jocelyn, you talk about it, kind of that roller coaster of the alarm goes off. That's what we think about. We think about what happens when the alarm goes off and the adrenaline rush and what exactly they're doing when they get to the fire, where there's so much else that actually is involved in that role. Mm-hmm. But how do you, as therapists, really break down that job, understand that job? What are the tools that you maybe use in analyzing the occupation, that occupational analysis?
One of the areas that we might be able to draw from is an understanding of the investment in the training that's required in order to perform those roles and functions. So we talked about the identity being wrapped up in the uniform and the meaning of that occupation. And for me, I was most surprised as my family member being trained as a 911 communication operator, the length of time that was invested in the training and the diversity of the training, which it really taught me a lot as I understood and walked through that process with the family member. And I think that that would be valuable for an occupational therapist to potentially obtain that information from someone, even if it's not the person that you're working with and providing clinical support to, but if you can find another to better understand the training, it helped me understand the job a lot better.
How would you do that? So do you call up the organization and say, can I sit in on your training? Can I have a curriculum of your training? What are some of the practical things an occupational therapist who might be listening to this podcast might be able to do or what might they ask the first responder or their employer to be able to get that information?
I think it depends on who you're going to for that information, but we've had some success with workplaces who are providing like their policies and procedures manuals, example training modules, providing a lot of documentation around some of the core competencies for a variety of the different first responders. And that's always really helpful to review. You know, I often kind of look at, you know, what some of the job classifications tell me are key areas of competency, what they will be doing, what are those requirements, look at the training for those specific folks in terms of fire, corrections, and then asking the client, you know, a lot about if they were going to train me, what would I need to know? And almost having them walk me through their position, almost like a day in the life of. And I want that level of detail so I can understand the complexities, because I think for first responders as a group, the level of complexity and the amount of you know, cognitive work that they're doing on the job is so high. I really want to understand how the mental health symptoms impact that level of cognitive functioning that they need. So that's how I kind of go about it in a couple of different ways.
I think, Vikki, you nailed it there. That for me, I get most of my information, I'd say, from the client themselves. Although I could, you know, and I've used job demand analysis, and I've, you know, done visits and things like that. But even from one prison to another, or one police role to another one, they're so different. And so I really want to understand from the first responder I'm working with, tell me what your job looks like. What exactly are you doing? And helping to understand it that way. And then when we're talking about whether or not they're able to go back, I think, as we know, the research says that one of the greatest predictors of whether a person can get back to work successfully is often their own, you know, understanding or their own assessment of can they get back. And so by asking them, of this role that you do, what are you most worried about? What are some of the biggest barriers? What are you afraid of? Or what skills do you think you are going to struggle with? And they're going to identify it really clearly. And so I think that's a really important part of the assessment when trying to decide if they can go back or not. And it may be something that you don't expect at all. It's all the peer relationships. You know, what are people going to think of me? That's going to be it. They think that their skills will all come back. They've got great muscle memory for how to do things, but they're worried about the interpersonal skills or interpersonal relationships, and that's their biggest barrier. So I think talking with them and understanding the roles and the barriers from their perspective is really critical.
I love that, Jocelyn, because I think one of the things that we can get caught in is, well, will their psychiatrist say that they're ready to go back to work? Or will their psychologist say they're ready to go back to work? Or, you know, what is it that their healthcare team is saying? And the person gets lost in that process. And I love how you go back to the core client-centeredness of talking to the employee and where are they feeling the challenges are going to be and the barriers are, so that you can help them to work through those challenges and those barriers, and being able to be very practical about that. And I balance that with what you told us earlier, is being careful about making a decision early that that person will never go back, because that individual may say, I can't ever see myself going back to work. But with the right tools and right strategies, that perception changes. And so that's one of the things I love about occupational therapy, is our ability to help that individual to have better self-efficacy through that process as they learn the tools and the strategies and see the possibilities. So that's why I love OT, is just because we don't actually make that decision off of medical and off kind of that first brush, but work with that individual to be able to develop the right tools and strategies and see how that perception changes. That's wonderful. Heidi?
Yeah, no, I agree as well. And I just wanted to add too, that I find it often helpful to just have the discussion of their strengths and what are other areas, say, our goal here is to get you back to work, and we don't know, we're going to work on it. And as a team, we're going to try to get you back there, but they're so worried, oh, am I going to get back to work? And they ruminate about it. Right. So I try to, from a perspective of, wow, what would be your plan B? What would be your plan C? You know, it's not for sure, and that's our goal, but what are some other ideas? And what, you know, let's explore that other piece too. You know, give them permission to think about, well, you know, there's two sides of things, right? But our goal is to get them back.
And I think it's that understanding too, in terms of physiology, that early on, if they haven't managed that physiology, that as soon as you start talking about that, and that they get that hyperarousal, they get that emotional response in terms of that fear, that freeze that happens, that if they're thinking that they have to make that decision, that's not the time to be making that decision until they've been able to regulate some of those emotions and be able to manage some of that. So again, it's so what are some of the strategies you use? We're kind of going past culture, but what are some of the strategies you use to help individuals to be able to know? So I'm a new occupational therapist, and maybe my question is going all over the place here, but I'm a new occupational therapist and I'm sitting with a first responder and I'm kind of talking about, I know that I've been hired to help this individual in terms of return to work, so I better focus on that. How do I know the right approach and the right timing in terms of having that conversation about return to work?
One thing that I have run into with some of my clients is the anxiety that is produced just by that unknown. When am I going to be told I have to go back to work? So they feel like they will not have any say in when that happens. And just listening to the stories, I think, has been a big part of it for me, is the listening skills are crucial.
Mm-hmm. Thank you.
To add to that, Moira, too, and I think part of what you're getting at there is the importance of allowing the time to develop that rapport with the client, so that the trusting relationship is there. And of course, we're all aware that we're working in a system where there are expectations potentially of, you know, returning to work as fast as we can. And certainly as professionals, that will be, you know, one of our main goals if that's possible within the file. But developing of that rapport and that trusting relationship with the client so that they're open and able to share their current circumstance and to get you to help them to understand what their other meaningful occupations might be, or their other job options if returning to work is not possible. And one client that pops into mind with me was a lot of her anxiety came from, when will she know if she's ready to return, or will she return? And so much of her identity being linked to that job, just the facilitation. In this case, she did not return to her previous employment, and it was very, very difficult for her to see herself as anything but.
If we could talk a little bit about trauma-informed care, right? So again, many of our clients have experienced trauma in the workplace. So if you think about some of those principles of trauma-informed care, it's about establishing trust, a sense of safety, empowerment, choice. So all of those things are really critical to help someone who's experienced workplace trauma and is really struggling with some of those things. So I think that's a lens, I guess, that we need to take in terms of any of the work that we do.
I love what you said there, Sandra, is that we do need to be able to look at making sure that we understand trauma-informed care. Thank you for listening to Dispatching Occupational Therapists, responding to the mental health needs of first responders, an Ontario Society of Occupational Therapists podcast. This podcast was produced by OSOT's Task Force on Mental Health and Return to Work. Don't forget to subscribe and leave a review. Make sure to follow OSOT on Facebook, Twitter, and LinkedIn to stay in the know about all things OT in Ontario. Links will be included in the description. Check out the episode description for any resources we mentioned throughout this interview. Until next time, thanks for listening.